Welcome back to HealthWise with our special guest, Dr. Lewis Mess with Plastic Surgery Associates. Dr. Mess, we were talking about how do you get involved, as far as maybe picking the wrong plastic surgeon or making sure you pick a board-certified plastic surgeon. I guess being in Louisiana where everybody is used to eating good food, weight is a problem.
Yep.
And the big thing now is gastric bypass. When you get this gastric bypass and you lose all this weight, of course you end up with all this skin and you end up needing cosmetic surgery. I assume you do that. And
yeah, it's one of those come lately, if you like, specialties in plastic surgery, almost a subspecialty these days, because even though the basic operation of a tummy tuck is used in, say, removing all the skin from someone who's lost a lot of weight, it's not the same operation because there are other issues, the genital issues, there are issues of a lot of skin all the way around the trunk, there are issues of sagging, and it involves thighs and arms and your neck and your chest, and ladies, their breasts. It's a whole specialty almost on its own, and it's very expensive for these poor patients to go through it because, even doing it outpatient like I do and working in a surgery center facility, these patients are usually under the anesthetic for 6 or 7 hours each time. You can imagine the type of costs that these run up because none of it is covered by insurance unless they happen to have hernias from their previous surgeries or they happen to still have big breasts, then you can sometimes get some help. But most of the time it's not covered. But there is an awful lot that we can do, and we can make these patients comfortable, and they're very good patients and very motivated. But, particularly there, you have to be careful who you go to, and you need to go to someone who's done a lot of it. Otherwise that can be botched too.
Could end up with scarring.
And you can end up being killed.
Oh, okay.
Because there are very big operations.
And I think that in itself is something that's very important that people need to understand and know, because liposuction, they make it, like I said, on TV, it's like, okay, we put this magic wand in you and just suck all the fat out, and that's supposed to, cure everything. That's a cure all. But it's a surgery. It's dangerous.
Well, let's talk about liposuction specifically now, because that absolutely is not a treatment for weight loss. That becomes a real expensive diet, because really the only amount, the recommended safe amount of fat that is removed during a liposuction procedure, the maximum, is somewhere between 5 and 7 pounds. Now, it's going to cost you $4,000 or $5,000 to have those 5 or 7 pounds removed. That's a very expensive diet, so it's absolutely not a diet. What liposuction is for the lady who has, say, saddlebags, and she can be as thin or as fat as she likes. They're not going anywhere. We can say, okay, we're going to take 2 pounds of fat off that saddlebag. Or someone with a double chin, for instance, who's thin but got a double chin. Well, we can take the fat off there. We can say where it's coming off. They've got a pooch on their tummy, or they've got love handles, whatever it happens to be. We can say, okay, we're going to take it off right where we want it off. Whereas a diet won't do that. You just get thin.
Okay.
So liposuction is really the only way to deal with so-called disproportionate fat. But it's not a cure for losing weight. It's not another way to lose weight. It's not a shortcut. And the other thing is, it's a major operation because you're under a general anesthetic, you lose blood, you're losing 5 pounds. That's the equivalent of amputating a leg,
Right.
You don't want to just do that, and it's not a shortcut, and then there's a recovery time, and there's pain of suffering involved, and if it's not done right, you can end up with a mess.
Right.
So liposuction is a good operation. It's a safe operation, but not for anyone.
Not for everybody. And I think it's important that that's said and that the audience understands that, because, like I said, once again, TV is deceiving. When you see these TV shows, it's always glamorous. They don't show the downside to and.
Well, the downside is uncommon if you're with someone who knows what he's doing. They're very, very good operations and very safe operations. But if you're with someone who is, say, an amateur surgeon, and you get problems, many of those problems are extremely difficult to fix, even if you then go to someone who's qualified.
Wow. Because the scarring is there.
Scarring and the dents and the lack of fat where you needed it and things like that.
Okay. We were talking about, like you said, the liposuction. What about other things like, breast enhancements?
Yeah, breast surgery is a very big part of my practice and probably evenly split between breast reductions and breast augmentations. Now, you know, if you're a chubby girl or a big girl, you tend to have big breasts, and if you're a little scrawny girl, you tend to have small breasts. It's at the body types, you know, the two extremes. And most people are in the middle somewhere. So, you know, the thin girls, the athletes, tend to have their breasts enlarged, and the bigger girls, you know, who are blessed, over-blessed, if you like to have their breasts reduced. And breast reduction is a fantastic operation. It's a life-changing operation for these ladies because of all that weight coming off their chest. All of a sudden they can function. And it's probably my favorite operation because the patients are so happy.
Okay.
And a second to that would be something like a tummy tuck, because the ladies come on in, you know, they've had all their babies and they've got a mess, and they want their muscles fixed up again, and they want to get rid of all those stretch marks and the skin tightened up and so on, and they're very, very happy.
So when you tighten up the skin, you're not just tightening up the skin, you're actually tightening up the muscle.
You try and deal with the whole problem, you know, because if you've got a big old bulging tummy, you know, from your babies, many times your actual muscles have been overstretched, you know, or the tendons and so on, and those all need to be tucked. And then, of course, the extra skin comes off, and that's a big lanyard. And then you can fit in your clothes again, and you look normal, and, you know, you just feel good about yourself. Many times it helps your backache and your bladder and so on.
So it's all, like you said, it's an all-around procedure. It's not just, you know, you're not just fixing right there. You're fixing the mind, you're fixing the body.
That's correct.
You know, just an all-over procedure. Well, Doc, like I said, we're going to be right back after this brief message from our sponsors, and we'll talk some more about body contouring.